Well, good morning or good afternoon, as the case may be, friends. We're very honored to have you joining us today. This is Casey Gwinn, the president of the National Family Justice Center Alliance, and we're very excited to have you with us as we host our monthly webinar of the National Family Justice Center Alliance. We're very excited and honored to have Dr. Jackie Campbell with us for the first of what will be a three-part series of webinars focusing on first this foundational piece around the danger assessment and then the development of health services, particularly with our focus on work in family justice centers and in collaborative multi-agency models that are providing services to victims of domestic violence and sexual assault and their children. You'll see as we get started today information on the screen about the webinar. We are recording this webinar. Everyone is muted during the presentation. We have over 400 folks on this webinar. And so you will be able to send in questions. If we don't get to them during the broadcast, we will provide them to Jackie and to our team at the Alliance, and we'll do our best to provide responses to those questions if we're not able to get to them during the webinar. We are particularly excited to be able to host this with our whole team present today, with the exception of Gail Strack, so we're enjoying participating in this as well. Our CEO, Gail Strack, is actually up in Fresno today, beginning early meetings about the development of Family Justice Center in Fresno, California. But as I said, my name is Casey Gwinn, and I'm honored to be hosting this today. We always do give a shout-out to our team. Particularly excited. We don't quite yet have a picture of Ruth Sampson, who just recently joined us, but we do have a picture of Mike Burke, who some of you know in the Family Justice Center world, who was the founder of the Family Justice Center in Shasta County, California, Redding, California, and developed and eventually merged that Family Justice Center with Shasta Women's Refuge and became One Safe Place. Mike's been doing amazing work up in Redding and just joined our national team as our Director of Community Engagement. So we're very excited to have him with us. I'm joined today by Michaela Farnsworth and Natalia Geary and Jen Anderson, who are kind of our technical assistance team for this webinar. We do particularly want to thank our sponsors for this webinar. We've been doing national work with the Verizon Foundation around health services and domestic violence over this last year, and we've been doing very concentrated statewide work in California supported by Blue Shield of California Foundation. And so this webinar is really a result of their amazing financial investment in our work and in the work of family justice centers, both in California and around the United States. As we get started, we always do like to mention our conference as it's coming up. We are going to have more than 500 people joining us. We're just about sold out, but our conference is coming up in San Diego, April 21 to 23. The theme of our conference this year is Health Matters, Hope Heals, what every professional needs to know about trauma. And we're very excited about our faculty and our focus areas and the island that we rented there on Mission Bay in San Diego. So if you're interested in that, I'd encourage you to go to FamilyJusticeCenter.com or .org. There's still a few rooms available, and we're going to have a backup hotel once we sell out at Paradise Point Resort and Spa. We will have a backup hotel as well until we finish our registration and can't take anybody else, which will come fairly quickly here. Just a reminder, we are recording this webinar. It will be available on our website at FamilyJusticeCenter.com. You click on Resources and then go to our resource library. That is fully available to our 11,000 members and to the general public now. There's a few documents and recordings that are password protected, but most of it is currently accessible to everyone, and this webinar will be as well. We also do provide California continuing education credits and MCLE credits. Unfortunately, our reach is only in California for those credits, but California's requirements are so stringent that you can usually get credits in other states for both attorneys and for therapists and others receiving CEUs. If you get all the materials, you will receive a checklist detailing how to obtain credit in your state after this webinar is over. And the materials will be available to you as well if you want to submit them to a continuing education provider in your state. We're very honored to have Dr. Jackie Campbell joining us today from Johns Hopkins University School of Nursing. Those of you that know Jackie know that she really doesn't need much of an introduction. She's an amazing woman that's been doing this work for more than 35 years and has just got an incredible history in the whole arena that we're going to be focusing on today. She serves on the board of Futures Without Violence. She is a Lifetime Achievement Award winner with the National Family Justice Center Alliance, one of our Lifetime Achievement Award recipients. She, of course, is the author and developer of the danger assessment that we're going to be focusing on today. And Jackie's published hundreds of articles. She's been involved in publishing or co-authoring 7 books. And we're just very honored to have her present today. And I just want to make one comment before I turn it over to Jackie. I mentioned this at the beginning of the call. This is really the beginning of a 3-part series that we are developing at the Alliance. This first piece will focus on the danger assessment and certification for those providing advocacy services to victims in family justice centers and other community-based domestic violence agencies. But we really see this as the springboard for what we want to do around health screening and health services in family justice centers and domestic violence agencies and other multi-agency models. So our second webinar will be focusing on our Health Services Toolkit that Sarah Wee from our team did an amazing job of putting together. It connects both to our Verizon Foundation work and to our Blue Shield of California work. That webinar will be scheduled shortly. After this webinar, you'll receive notification for that. But this is really the foundation. We believe that the danger assessment is the tool that we can build from to really start doing real health screening and health assessment and referral to health services and the provision of health services for victims of domestic violence. So it's my great honor to introduce Dr. Jackie Campbell and turn it over to her. Jackie, thanks so much for joining us today.
I am delighted to be here, Casey. Thank you so much for that wonderful introduction. I am always delighted to do anything with the Family Justice Center Alliance, and all of you that are part of the Family Justice Center, my hat is off to you. You do amazing work, and it's a wonderful resource for our country, and especially for women and children who are experiencing domestic violence. So I'm going to talk about the danger assessment today. I'm going to go very fast. As Casey said, you can go back and review this PowerPoint. You can also go onto our website and review a PowerPoint once you get certified. So in terms of background, first of all, in this country, when women are murdered, 40 to 54% of them are murdered by a husband, boyfriend, or ex-husband or ex-boyfriend. That's in comparison to 5 to 8% of men who are murdered by a partner or ex-partner. For women, this is 9 times the rate that are killed by a stranger. So women are far more likely to be killed by a husband, boyfriend, or ex than by a stranger, but yet still in this United States, I think that most women think they should be afraid of a stranger in the night. Homicide is the 7th leading cause of premature death for women in the United States overall. It's particularly a concerning cause of death for young African American women, for which it is the #2 cause of death, and it's the #3 cause of death for young American Indian Native Alaskan women. We also find that immigrant women are at increased risk for domestic violence homicide, at least in New York City, where there has been a good study linking the foreign-born status with increased risk of homicide from a partner or ex-partner. It may be true in other immigrant communities, especially because of the isolation many times of immigrant women, and also their fear of reaching out for help because that someone may get deported or they have been threatened that a family member would be deported by their abuser. When women are killed by a partner, in at least 2/3 of the cases, there has been prior physical violence beforehand. When a male partner is killed by a female partner or ex, there's been prior abuse of her in 75% of the cases. The take-home message there, and if you get certified on the danger assessment, there is a test, a true-false test, 7 items. You get 3 chances to get 4 out of 7 correct. If you miss after 3, you can email us and we'll reset it for you. So one of the questions that oftentimes comes up on the test is this take-home message. When there is a domestic violence homicide, whether a female is killed or a male is killed, the #1 risk factor for that kind of homicide is prior domestic violence against the female partner. Women are more at risk when they're leaving or have left an abusive relationship. The first 3 months is the most dangerous. The whole first year is also a time of increased risk. We all know that women oftentimes leave and come back and leave and come back in a very normal process of separating from an abusive relationship. But that whole time of leaving, that whole process of leaving is a time of increased risk. The other thing we also need to remember is that eventually women will be safer after they leave the abusive relationship. After that first year of increased risk, they will be safer than if they had stayed in an abusive relationship. We also need to remember that therefore we as a community, we as family justice centers, need to take particularly good care of women during that leaving process. That's the time that they are at increased risk. That's the time that they need us to be very vigilant, very much advocacy on their behalf during that time of leaving. Some recent data has indicated that although intimate partner homicide of women has decreased in urban areas, there's been a slight rural increase, again because of the isolation of rural communities and the fear oftentimes that if a woman calls for help, that everyone will find out. That it'll be, if she calls the police, it'll be somebody's brother, somebody's cousin who comes, and the word will get out that way. Even if she goes to a health care provider and tells them about abuse, there's always the concern that the word will get out because of close-knit, isolated communities. It's also oftentimes rural communities are isolated from helping centers like a family justice center. And the other background piece of information we always need to take into account is that 40 to 47% of the femicides in our national study were seen in the healthcare system in the year before they were killed. We found that only 4% of the women that were killed had been in a domestic violence services agency or had been in contact with domestic violence advocates. Now, I like to think of that as if more of them had been in touch with domestic violence advocacy services, more of them would have lived. But still, it is very important for us to remember, and that's why this toolkit is such a great thing, that we need to be collaborating closely with healthcare systems in order to make sure that women that are there who are abused are getting the resources and the help that they need. We also know from a book by Brian Valley that came out in 2007 that during the years of 2000 to 2006, far more women were murdered than soldiers were killed, even though this was at the height of the Iraq and Afghanistan war. And far more women were murdered during those years than law enforcement officials were killed during those years. Again, both those soldiers and those law enforcement officials, those are tragic deaths, but I don't think, again, that the public is aware of how many women are murdered every year in comparison to those other categories. Children are also involved in these intimate partner homicides. In approximately 19% of the time when a woman is killed, a child is also killed. And if you're looking at the slides, you see here that data comes from Neil Websdale in 1999. That was a long time ago. But we don't really have a good system for keeping track of the number of children who are killed in domestic violence incidents. We also know for every one woman who is murdered, there's 8 to 9 attempted homicides, attempted domestic violence homicides of a female. And again, we don't have, this is approximate numbers. We don't have a good way of keeping track of those near fatal events. We found in our study that when a woman was killed or almost killed by a partner, in approximately 70% of the cases when there was a child who lived in that home, a child was either witnessing that intimate partner homicide or the first to find the body of their mother, or when women were almost killed, the first to find her after a near-lethal event. And yet less than 60% of those kids received any kind of counseling, and many times only one counseling session. And if you think about the trauma, you think about in those domestic violence homicide cases, somewhere around 70% of those cases there was prior domestic violence against the mom, so they were traumatized by that continuing domestic violence, that being in the home where the domestic violence was occurring, and then to have the trauma of your mother killed by your father or father figure, and oftentimes being actually witnessing that event or being the first to find the body. We know from other research Barbara Parker conducted that women who, that adults who were in a home where their father killed their mother or the mother killed their father grow up with serious problems later on. And yet most of us in most of our communities, we don't have a clear protocol for addressing those children that are in homes where there's a domestic violence homicide. We don't reach out to them. We don't help whoever is going to take custody of those children, and oftentimes we found there were custody battles. Kids were oftentimes split between mom's kin and dad's kin, so that they oftentimes did not have each other for support. So that is a serious traumatic event that if we can do more to reach out to those kids that are directly affected by that, making sure that they get the kind of counseling that they need, and also making sure that whoever is going to raise them has the information they need about the trauma that these children have experienced, how to deal with that trauma, and if they themselves, I mean, we know that growing up in a home where there's violence, growing up in a home where you yourself are abused is a serious risk factor for being involved in domestic violence as an adult. So we find in many of these families that the grandparents who take custody of these traumatized kids are ones that abused their own children when they were growing up, or were abusive toward their partner when that child was growing up. And so that intergenerational cycle is likely to continue even more so when kids who were in a home where there was domestic violence homicide are raised by perhaps abusive grandparents. So there needs to be some intervention on our part, and I have said this before to Family Justice Center audiences, and I am sure that there is more being done in Family Justice Centers around that, and I would love for us to keep better track of that. The other thing we know is that women are oftentimes killed while they're pregnant, and this is another way that children, unborn children in this case, are involved. And in many states, including the entire state of Maryland, homicide is now the leading cause of maternal mortality. That's when a woman is killed when she's pregnant or in the year after a pregnancy is terminated, either by a live birth or is terminated with something like a homicide. So we don't keep very good track of those homicides either. Many maternal mortality reviews do not include looking at homicides, and this is something that we need to do a better job of tracking. The one data set that does combine medical examiner data, like the autopsies that are done of a woman who is killed during pregnancy, or a suicide death that's kept, those records are kept through medical examiners and it's kept in departments of health. The National Death Reporting System for the first time does link those medical examiner deaths with deaths by homicide, which are kept through departments of justice at both, and the FBI at both the state and federal level. If we link those two databases, we can see for the first time systematically how many kids are killed when there's a domestic violence homicide. There's 17 states now that are in the NVDRS, the National Death Reporting System. California is one of them. You can see the other ones there on the slide. And there are more states that are joining, but it's a matter of resources in terms of somebody being tasked to do the linking of the two databases, usually in departments of health. We're only slowly getting a good national database that includes all of these factors. The one analysis that was done fairly recently in 2014, it was published, of intimate partner homicides, they found that there were 2,903 intimate partner homicides in those 17 states. 77% of those, it was a female victim. And when a female victim was killed, 54% overall, those 17 states, a gun was used. So more than half of those incidents, guns were used as the weapon. In 11% of those cases, females were strangled as one of the other major means of the homicide. 38% of those cases, the male perpetrator killed themselves afterwards. These homicide-suicides are very common in domestic violence homicides. It's almost always a male partner who kills himself after he kills the female. And I'll talk more about that later in terms of the specific characteristics of those homicide-suicides. 460 of those incidents are what we call a familicide. That's when someone kills more than one family member at the same time. So in those 460 incidents, there were some where children were killed. When it was a familicide, 91% of those cases, it was a male perpetrator. Women hardly ever commit a familicide of any kind. 77% of those male perpetrators were non-Hispanic white men. So oftentimes these familicides do involve white men more so than other race ethnicities. 80% of those familicide cases was a male intimate partner killing a wife, a girlfriend, or ex, and another family member, and most often it was a child that they killed, and they oftentimes killed themselves afterwards. In 88% of this kind of familicide, a gun was used, much more often than a gun was used. And we found that children below the age of 11, 133 of those children were killed. 350 children were killed less than 17 years old, and that was 10% of the femicides, intimate partner femicides in this database. So again, we have at least some proportion of our intimate partner femicides where a child is also killed. And although the children are often very young, they are also sometimes adolescents. In this slide, we see the categories in our National Domestic Violence Intimate Partner Femicide Study. Of the 311 cases, you can see that the ex-boyfriends were 19.3%, an important category. The other category I want to bring note to is that 2.6% of the women who were killed by a same-sex female partner. When we looked at those cases specifically, very few of them, but we examined them as a case study, we saw that the dynamics were very much the same prior domestic violence in the majority of those cases, oftentimes a primary perpetrator. We also saw some other risk factors, most of which were the same as with the opposite sex domestic intimate partner femicides, but some characteristics were somewhat different, so we have developed a danger assessment for same-sex female couples. That's called the DA-R. It's available on our danger assessment website if anybody wants to look at it and perhaps use it. It's not as well validated as the danger assessment for a male perpetrator of domestic violence and a female victim, but it is available. It would be very important for someone, if anybody out there wants to work with me on it, to look more carefully at same-sex male intimate partner homicides. They do occur. They actually occur more often than same-sex female intimate partner homicides, and it's an area that we need to do a lot more research, and we need to develop a same-sex male danger assessment. Whoops, I'm sorry, I went too fast. There we go. This graph shows that over the past 30-some years, we've had a significant decrease in domestic violence homicides. This is a really good thing. You can also see that it's very striking that the domestic violence homicides of men has gone down far more than the domestic violence homicides of women, where in 1976 it was almost a 1-to-1 ratio. Now in 2007 it's more like a 4-to-1 or 5-to-1 ratio. For every male who is killed by an intimate partner, there's somewhere around 4 to 5 women who are killed by an intimate partner. You can also see on this graph we didn't even start counting the ex-boyfriend, ex-girlfriend category of perpetrator until the mid-1990s, and this adds a significant number to domestic violence homicides. What has happened in terms of the decline in domestic violence homicides, especially for men, is first of all that improved domestic violence laws and resources have accounted for a great deal of the decline. In other words, that compared to 1976, women who are being abused now know that they, for the most part, that they can call the police and get a good response, or that they can get domestic violence resources from advocacy organizations. And this means that those abused women feel less like the only way out of the situation is to kill their partner. We also find that another thing that has accounted for a lot of the decline is improved income for women. We all know when we work with abused women that if they have resources of their own, if they have a job, that this makes it far more possible for them to do something to address the domestic violence in the relationship. The other big thing has been the gun availability decline. There's been a really good evaluation that was done by Jim Mercy and Victor that shows that in states where there's purchase restrictions in place, where orders of protection go into the federal database, and most importantly, where orders of protection deny possession of firearms to the respondent in an order of protection. In other words, where it clearly states that possession is denied versus just a new purchase. And in those states, we've seen a decrease in homicide of female partners, and especially firearm homicide, of 12 to 13%. In those states, we've seen an overall decrease in intimate partner homicide by 10%. And this is extremely important data to use to continue to support the laws like in California, which really are the best in terms of denying possession of firearms from known domestic violence offenders. It's also important to realize that this has been upheld twice in the Supreme Court of the United States. So if you get pushback on those grounds, it's been upheld. This right to deny possession has been upheld 2 separate times by the Supreme Court. Even so, we have implementation challenges wherever we go. It always depends on the jurisdiction how rigorously these gun removal provisions are actually implemented. very much up to judges, so that's one of the things we need to work on. This just graphically shows that since 1976, as our hotlines have increased, as our legal advocacy for domestic violence victims has increased, our intimate partner homicides of both men and women have gone down. And also in terms of the guns, we see that we have had a sharp decline of domestic violence homicides with guns, even though it's still the majority of cases, it's still that 54%, while the domestic violence homicides without guns has stayed very steady. So a lot of our decrease in homicide is related to that gun removal. Now, I'm a baseball fan, and even though it's desperately snowing here in Baltimore, spring training is going on, and every year in spring training for baseball, if you read all kinds of predictions about what's going to happen for our team, whether or not I'm a Baltimore Orioles fan, whether or not the Orioles are going to do well or they're going to be at the bottom. You see all kinds of different predictions, and as Yogi says, it's very hard to really make accurate predictions, especially if it is about the future. And so one of the things that I have been engaged in since the 1980s is trying to help abused women predict, assess how dangerous their situation is. One of the things I discovered early on is that women oftentimes underestimated their risk of being killed by their partner. Not that this was pathological. This is absolutely, again, a normal process that human beings do, because it's very hard to get up in the morning and be functional thinking that the man who's supposed to love you the most is very capable and might well kill you. So women put that to the back of their mind. And the danger assessment is designed to help her see for herself. Very early on, I did an early study of domestic violence homicide in a small town, Dayton, Ohio. And as I talked to abused women, I started volunteering in support groups in shelters, and I would identify abused women in healthcare settings. As I talked to them, oftentimes they would tell me their story, and I would think, oh my, that's way too much like one of these domestic violence homicide cases where I had reviewed the police reports. And I would think to myself, how can I get her to see that this is a dangerous relationship for herself? I'm far more scared for her than she seems to be scared. And I don't want to scare her to death unnecessarily, but I want her to help her make a more accurate assessment of the degree of danger. So I developed the danger assessment. I developed it with women in support groups with abused women. We developed the wording there. Hopefully you've been able to print out the danger assessment so you can look at it in front of you. If not, it's available on the danger assessment website. You can download it there. You can download it anytime. It's free. It will always be in the public part of the website. So importantly, one of the things that I realized is that many abused women, if I would ask, is the abuse increasing? And you see that that's the #1 question on the danger assessment. And when I would ask women about that, oftentimes they would say, oh no, it's not that bad. It's only a little pushing and shoving. It only happens every once in a while. And I would think, I wonder if she's really accurate about that. I wonder if that's really a good description of the abuse. But I never, like to push back at abused women. I would much rather they see this for themselves. One of the things I had learned in working with abused women in support group is that they were strong, they were resourceful, they were very smart. And so adult learning models would tell us that people learn things, take things in, become much more aware if they see it for themselves. So when I was working with support group, we worked on the wording of the risk factors. And that's why the only reason that it's copyrighted is so that people don't mess with the wording and use it as is, because that's what's been tested. And then also this calendar approach. What you do is you ask women to mark on the approximate date on the calendar times that an abusive incident occurred. There's a scale of 1 to 5 that's given up at the top of the danger assessment. The directions for this are right up at the top of the danger assessment. I have many women who do the danger assessment online now. They do it perfectly well by themselves. They can fill out that calendar by themselves if you need to be doing something else, or if you are able to do it with them. It's incredibly instructive in terms of exactly what the pattern of abuse is in their relationship. The calendar, there's a calendar available on the danger assessment website in the public portion, so you can download one of those and use them. You want people to work backwards. So if you were to go to the danger assessment website now, you would download the 2015 calendar and the 2014 calendar. You would ask women to start with March of 2015, work backwards on the calendar through April of 2014, and mark on the approximate date an abusive incident occurred, and on that scale of 1 to 5 how severe it was. Now, severity is both in terms of the tactic that's used, was it a push, was it a shove, and importantly the injury that resulted. So if they were pushed and they fell down the stairs and they broke an arm, then it would be that number 3, which is the more serious number. Then what happens is once she does that on the calendar, she can see those numbers. She can see for herself what the pattern of abuse has been. And anybody that uses the danger assessment, that gets certified in the danger assessment, use the calendar. It is incredibly important in terms of cutting through that normal minimization that abused women do in terms of how severe and frequent the abuse is. We've actually tested it, found that about a third of the women that put a no to number 1 without doing the calendar changed that no to a yes after doing the calendar. One woman in Alberta, Canada said, "You actually see your own roller coaster ride." It was on the calendar. So this is much more in respect for abused women as an adult learner, strong women survivor kind of a model. So as I was developing the danger assessment in the 80s through the 90s, and then doing the big study that I'm going to tell you about in 2000, there was also a high demand for both lethality assessment, risk assessment, and reoffending risk assessment by all the different parts of the system. So it's important as you think about these issues, as you use these tools, that you understand that risk assessment in the domestic violence field usually means risk of reoffending, risk of domestic violence happening again, while lethality assessment is the risk of someone dying or almost dying from domestic violence. And although those two things overlap, the risk factors aren't exactly the same. So one of the things that was happening in 2002, we found that a probation department was successfully sued for not recognizing potential lethality in an abuser. Most probation departments, almost all of them, assess every probationer for risk of reoffending any type of criminality. So it's usually a general criminal offenses. What's the risk of this particular probationer doing something that's against the law again? Excuse me. And in this particular case, an abuser was given a very low level of risk for reoffending, being a criminal in any way again. He was on probation because he had beaten up his wife very severely, but he had no other criminal history. He wasn't violent toward anybody else, at least in the official roles. And so he was given a very low level of supervision, telephone only. And that they also, although the court stipulated that he was to have a better intervention program, he only went 2 times to a counselor for an anger management program. So there was also the failure to assure completion of an adequate better intervention program. So he was given low level of supervision. He called in once a month, said, yes, I'm still working. No, I haven't done anything terrible. And 6 months later, he killed his wife. So that probation department was successfully sued. They settled, so it's not in case law, but one of the things that happened as a result of that is probation departments began to realize that they needed to do a separate domestic violence risk assessment for abusers who were on probation. So that's been one of the developments that has happened over this time. Another thing that you always need to keep in mind in terms of this risk assessment enterprise is in domestic violence there's 4 interacting parts to consider. There's the instrument. What instrument are you using to assess risk? What's the purpose of it? How accurate is it? Has it been validated? There's the risk assessor. Who's doing this risk assessment? Is it you who are attending, giving up a precious hour and a half of your time in order to attend this webinar and get trained in using the danger assessment? Or is it a clerk that you're giving a one-page checkoff list who doesn't know anything about domestic violence? So it's how well-versed is the risk assessor in domestic violence. There's the perpetrator of domestic violence and how dangerous is he or she, and most of our instruments have been validated on he perpetrators, which makes sense because there's more of them, but we also need to check to make sure that whatever instrument we're using has been validated or not on female perpetrators, because we also know that there's female offenders of domestic violence. And then importantly, there's one specific potential victim. There's one case of domestic violence survivor victim that we're particularly worried about and concentrating on. Although offenders sometimes do serial domestic violence offending, they offend one partner and then another and then another and then another. Usually when we're working with the case, it's one specific potential victim, and what that victim does makes a difference. Then briefly, and you may never want to have known this much detail, but it's important because if you use the danger assessment with a victim or survivor and they want it to go to court, then you will, if it's criminal court, you will go with it as an expert. So you need to know a few of these things, and one of those things is actuarial risk assessment instruments in comparison to structured clinical assessments. An actuarial risk assessment instrument is one that was developed only on a large database. So computer-assisted programming was used to identify the things that differentiated an abuser who only was arrested once for domestic violence to those that were arrested more than once. And then that instrument is weighted depending on how much individual risk factors predicted who would be rearrested for domestic violence versus those who were never rearrested. And then using those factors as the risk assessment instrument, and as you can tell, this would be risk assessment for reoffending. Then another data set is used to test that instrument, and is it well validated, and does it predict accurately? In comparison, a structured clinical assessment is where you have factors that you assess for that are known to be associated with increased risk of either reoffending or lethality. And then you, as the risk assessor, determine how much weighting you should give them. Now, the danger assessment, when it first started out, was a structured clinical assessment. There were questions, there was areas that you were supposed to assess, and you can see on it, it says down at the bottom, the more yeses, the more danger. So there wasn't any weighting involved, and there wasn't any cutoff score. Now that we've done the validation study that I'm going to tell you about, we have much more like an actuarial risk assessment in terms of the danger assessment. So, but you have to use the weighted scoring for it to be classified as an actuarial risk assessment. One of the other issues and challenges in this field is a lot of fears that risk assessment will be used to limit services to victims, and the fear of false negatives. This is when you assess a case for risk of lethality and you say that it's a quote-unquote low-risk case and that something horrible happens. And we all fear this, and a lot of people are worried about risk assessment because of the possibility of false negatives, that when we underestimate risk, or the possibility that agencies will say, well, only people at high risk get X, Y, and Z in terms of services. So we have to be careful of both of those things. So as I mentioned, the risk factors for reoffending, that risk assessment circle in green there, overlaps with the risk factors for lethality, but they're not exactly the same, and they're not weighted the same. So it's overlapping concerns, and they're similar but not the same. The other area is safety assessment. One of the things that we need to do more research on is to determine which of the safety strategies that we might advise a particular woman to do really will keep her safer. And then the safety assessment is also in terms of what are we doing as a community, as an agency, to make sure that victims and survivors are safer, and which one of those things that we are doing that we think are really good policy initiatives really do work, really do keep survivors safer. So that's another area that we need to do more research on. So this is this notion of the true positives, true negatives, that false negatives that I talked about briefly, and false positives. So every risk assessment instrument that's been validated, it's been tested using these statistics. Also things like mammograms, for instance, which is what we're trying to do is determine the risk of someone dying from breast cancer. We're trying to identify the breast cancer tumors that are potentially lethal when we do a mammogram, and the guidelines for mammograms, how often you should have them, at what age you should have them, are based on a risk prediction model, an ROC curve. And we also find for PSAs the same kinds of modeling goes on, looking at these this 4-quadrant model. So briefly, true positives are when we say this is a high-risk case and indeed violence occurs. That's expressed in a percentage. It's called sensitivity. The true negatives is when we say, nope, this is a very low-risk case, no violence is going to happen here, and no violence occurs. This is called specificity. When we're wrong in our predictions, we call it false positives. If we predict violence and no violence occurs, and this is a problem in terms of scaring people unnecessarily. It's also a problem in terms of perhaps denying liberty to people that are not that dangerous, that are not likely to reoffend. And then our false negatives, what keeps us all up at night, that we have predicted inaccurately. We have said this is no violence is likely to happen, and some sort of horrific incident occurs. Now, when you combine those two, the sensitivity and the specificity, and you look at the accuracy of an instrument predicting risk of something, we have an ROC curve analysis. It stands for Receiver Operator Curve Analysis. And this is a picture of an ROC curve for the danger assessment. What we did was we calibrated the danger assessment and the actual femicides in our case control study, and then we tested it on the attempted femicides, and we were able to accurately capture 90% of the cases under the curve. The ones up at the top, up in the left-hand top corner outside of the curve, we were wrong. We either underestimated risk or overestimated risk. But this shows the accuracy of the danger assessment. And again, that may be more statistics than you wanted to know, but if you go to court and you can briefly explain this, this will make sure that you're validated as an expert. And you can go back and, I always do, review this online before you appear in court. There's also the article that this analysis explained more in depth on our danger assessment website that you can refer to. So the femicide risk study that I mentioned, our purpose was to identify and establish the risk factors for intimate partner homicide of women over and above prior domestic violence. So we wanted to know which abused women were most likely to get killed by their partner or ex-partner. And again, I noticed this clinically. We actually tested it in the study. 54% of the women that were actually killed and 45% of the women that nearly killed did not see it coming. In fact, underestimated their risk. Now, abused women hardly ever overestimate their risk. So if she says, he's going to kill me and this is why I'm afraid of that, you need to take that very, very seriously. But as I said, women will oftentimes underestimate their risk. We had a great interdisciplinary team, criminologists, physicians, domestic violence advocates, and nurses who worked with us. These are the cities where we did the study. This is in PowerPoint that you can see. I oftentimes say this is to prove I can actually do PowerPoint when I pay attention to it. We have Seattle, Washington, Portland, Oregon, Los Angeles, California. This is Wichita, Kansas. It's the only truly rural site, so one of the big limitations of this study is it was primarily of women living in cities, in urban areas. We had Kansas City, Kansas, Kansas City, Missouri. This is Houston, Texas, Chicago, Illinois, Tampa, St. Pete, Baltimore, Maryland, and New York City. The way we went about this is a case control study. What this means is we looked at cases of women who were killed by their intimate partners. We went to the police homicide files in those cities. We looked at every consecutive case where a woman was killed. We looked to see if it was a partner or ex-partner who had killed her. Those were the cases that were kept in the study. Then importantly, not only getting the information that was in the police homicide files, we identified a proxy. We identified a family member or close friend who could tell us what happened in this relationship leading up to the event, who could tell us about the domestic violence, much of which was never in any official police file. There were not orders of protection in many of these cases, but there was prior domestic violence in the majority of them that a proxy could tell us about. Our best proxy informants, the people most knowledgeable about what was happening in that relationship, were sisters, brothers, and best friends. Sometimes a mom would know, but not as many mom were in on what was really happening in the relationships than I always thought would be. Our controls, our comparison group, were women who were physically abused by intimate partners in those same cities. We interviewed those women, talked to them by phone so we could get the information directly from them. It was a population-based random sample survey in those same cities where we used the homicide cases. Then we had a second set of cases who were women who were almost killed by their intimate partners. We could talk to those women themselves just to make sure that the information we were getting from proxies would be replicated in information we got from women who were almost killed by a partner. In order to be part of the attempted homicides, the women had to have had a gunshot wound or a stab wound to the head, neck, or torso, strangulation or near drowning with loss of consciousness, severe injuries that easily could have led to her death. The example I always give is there was a woman here in Baltimore that was pushed over an overpass to the highway below, gravely injured, but managed to live through it. So these are women that could have, should have died except for some great instant medical care intervention or some stroke of fate. And so these were women that truly had experienced a near homicidal event. They were difficult to find. There's not any nice, neat database of attempted homicide victims. I would love to do a study that was really systematic of just attempted homicide victims across the country. We did recruit them from shelter records, from trauma hospital databases, from DA offices, but many of these cases the perpetrator pled down, and so they never were in the prosecutors. They had never been prosecuted for anything like an attempted homicide. So it was hard to identify those women. And then when we tried to contact them, many of them had moved from wherever they were shot or stabbed. You know, I always say, so would you, if you had the resources to do so. So this sample, the attempted homicide sample, is not nearly as systematic as the actual femicide sample, and because we had a hard time finding women, and it was skewed toward women who were poor because they were less likely to have the resources to be able to move. We also did a subsample of 30 of these women with in-depth interviews to gain additional insights in terms of how the risk of homicide operated. So when there was a femicide or an attempted femicide, as you can see on this slide, about 70% of those women who were almost killed or the proxies for the women who were killed reported that there had been prior physical abuse in that relationship. It had increased in severity and frequency in the majority of those cases, but not nearly all of them. But what was much more common was stalking. Now, as I mentioned, the wording of the danger assessment, we got the wording from women themselves. One of the items, it's number 19, is the stalking item. But you notice it doesn't say the word stalked. You don't ask an abused woman, does he ever stalk you? Because she's thinking of, you know, movie star stalkings, those kinds of issues. But you need to ask specifically in terms of the behaviors. Does he follow you? Does he leave threatening messages? And that can be on email, on text, on be a written note, as well as an out loud kinds of threats. Even when there was no prior physical abuse, there was stalking in the majority of the cases. So it's very important that we consider stalking as an instance of domestic violence, and that we make sure that violations of protective orders, that we don't just be sure to enforce violations that include physical violence, that those stalking provisions that he cannot come within so far are very important, that we address those also when there's an order of protection. We can also use orders of protection for stalking only, and that's an important tool in our toolbox. Our controls, as I mentioned, were women in the same cities who were abused. We did a telephone survey, and we carefully followed safety protocols. The sample that we did the multivariate analysis on, that I'm going to show you the results of, is here. Femicide cases 220, attempteds 143, and 356 abused women in those same cities. When we looked at the demographics, and here in this chart, the white column is the men who killed or almost killed their partners. The red column are abusive men in those same cities. We got the information about them from their partners. The yellow are the femicide, attempted femicide victims, and the blue are the abuse victims. On this slide, you can see that being African American, we had more African Americans who killed their partners. That being white is somewhat protective. We had fewer white men who killed their partners than abusive white men. And being Hispanic neither increased nor decreased the risk of killing or being killed or almost killed by a partner. But importantly, we looked at the demographics further, and we found that the men who killed or almost killed their partners were the least likely to have a high school education. Only 47% of the men who killed or almost killed their partners had less than a high school education, and that's a pretty low level of education in this country. And most importantly, they were the least likely to have a job. And when we put all of these demographics together, and this is, number 2 big take-home message, unemployment is what drove it. An unemployed white man was as likely to kill his partner as an unemployed African-American man. That's because there's so much more unemployment amongst African Americans that it makes it look like it has something to do with race. When we see that inequity for African American women being more likely to be killed in this country, it's unemployment that drives that demographic. It's very important to keep in mind, and that's true also for homicide in general. That the apparent discrepancy in our country between African Americans and white people in terms of murder is mostly related to low income, low education, and the unemployment. So in terms of the risk factors that are on the danger assessment, in terms of looking at them, just the percentages that were had this characteristic amongst the women who were killed or almost killed in comparison, and that in that control column are other abused women in those same cities. So there's a significant difference in increase in frequency and severity between those who were killed or almost killed and those who were abused. Importantly, the tried to choke the victim, and again we use choking language for the danger assessment because that's for women, that we're asking women about choking. To ourselves we say, as the Family Justice Center has taught us much about, we say that was a strangulation event. But women will respond much more to the words choking. They oftentimes think if we use the word strangle that we're talking ligatures, we're talking horror movies, not him putting his forearm against her neck against the wall until she slumps to the ground unconscious. We've also found, just briefly, that in recent research we've done in Oklahoma, that multiple strangulations are particularly associated with increased risk of lethality, and that strangulations to unconsciousness is another sign of a very potentially lethal abuser. Gun ownership, and I'll talk more about that in a minute. Forced sex is another one where language is important. We should think to ourselves, he raped her, he sexually assaulted her, but we ask someone about their partner or ex-partner, we use the word forced sex because, again, that is something she can relate to, and she thinks about rape or sexual assault as referring to a stranger event, a stranger perpetrator. The other one there you see, believing the partner is capable of killing her. We tested that victim perception in a number of different ways, and that was the one that most differentiated women who were killed or almost killed from those that were abused. The guns, as I mentioned, I wanted to mention again briefly in this chart, the women who were killed or are in the red column. The perpetrator of the actual homicide is in the red column on top of perpetrator, and attempteds are in the blue. Yellow is for abused women and perpetrators, and non-abused women in those same cities are in the purple on this slide. So the victim owning a gun neither increased nor decreased her risk of being killed by that abuser. And you can see those columns are almost exactly the same, or by a partner. Now, the perpetrators who killed their partners, 74% of them were gun owners before they killed her. 53% of the men who almost killed a partner were gun owners before they killed her. This is not access to a gun, this is gun ownership. And again, he may not have papers that, you know, say he officially owns that gun or has a legal right to have that gun, but in his head, he owns that gun, and many of these abusers are multiple gun owners. 27% of the abusive men were gun owners, and 13% of men in those same cities who were non-abusive were gun owners. So another way to think about it is twice as many men who are abusive feel it's necessary to own a gun in that city because of whatever. Many times in Baltimore, people will say, well, I own a gun because it's a dangerous city. Twice as many abusive men feel it's necessary to own a gun. 4 times as many men who tried to kill their partner found it necessary to own a gun. And 6 times as many men who actually killed their abused partners were gun owners before they killed her. Importantly, this is a busy slide, bottom line here is about 1/3 of the men who killed or almost killed their partner with a gun should not have had that gun beforehand. They either had a prior arrest for domestic violence, in which case you're not supposed to purchase a gun. If you've been arrested and convicted for domestic violence, a misdemeanor or felony, or they had an order of protection out against them at the time that they used the gun to kill or almost kill her. And so I say that's a system failure. That's us as a community failing to remove guns from known abusers. And so definitely this is a place where we can do better. Again, some of the other risk factors, the controlling all of the victim's activities, and you can see on the danger assessment it says control most or all of the victim's of your, because it's asking her, activities. So we know that most abusive partners are controlling. What we're trying to do is differentiate the lethal or nearly lethal partners from those that are ordinarily abusive. In other words, ordinary control versus the very far extreme of control. So it's important that we differentiate that, and so it's important to use that language. Beating during pregnancy, again, that's strong language, but that's to differentiate. There's a lot of abuse during pregnancy. The perpetrator who is lethal or almost lethal actually beats their partner while they're pregnant. This is a serious sign of lethality or near lethality. The jealousy one, again, this is the far end of the continuum of jealousy. Most abusers are jealous, but the nearly lethal ones are violently and constantly jealous, and they often say things like, if I can't have you, no one can. It's really quite chilling how often that is uttered by men before they kill or almost kill their partners. The victim threatening or trying to commit suicide is not a risk factor for him killing her. However, it's another way that abused women can die. In fact, prior domestic violence is one of the major risk factors for suicide for women. So that item is still on the danger assessment, but when we get to the weighted scoring, you'll see that it doesn't count in the weighted scoring. However, the partner threatening or trying to commit suicide is, and that's particularly important in the homicide-suicide cases. The violence toward the victim's children did differentiate significantly, not as strongly, so we've replaced that item with, does your partner threaten to harm your children, which is more differentiating and also it casts a wider net. The partner is violent outside of the home was not that different between abusive men and the men who killed or almost killed their partners, and other risk factors are much stronger, so that's not actually on the danger assessment. Now, I'll talk more, first of all, about the hurting a pet on purpose. We did not find that to be a risk factor for homicide. Now, if the abusive man actually killed a pet, that probably was, but we didn't have enough of those cases. We had a couple. The most horrific one that I oftentimes mention is a man who cut a dog's throat, put it in the bathtub for his wife to find when she went to take a bath that night. Now, talk about a chilling thing, and that passes what I call the hair on the back of your neck test. It should, at least. If you hear anything that horrific, then I'll show you in a minute that you can bump up the score slightly between the levels of danger. But bottom line, although pet abuse in general is a strong risk factor for domestic violence happening, in the first place, it's probably a strong risk factor for risk of reassault. For abusers who may reassault their partner, I betcha, are likely to be pet abusers, but that hasn't been tested specifically. However, it does not differentiate those who are killers or almost kill their partners from those who do not pet abuse by itself. But as I mentioned, killing a pet may well differentiate it, but there wasn't enough of those cases to put it on the danger assessment. The other thing that's interesting is perpetrator military history. We did test that. We found that in this data set it was not predictive of homicide. However, most of the abusers in our data did their, if they were veterans, they were veterans of the first Iraq War where there wasn't much combat, so there wasn't a lot of PTSD. We know from veterans coming home now who have experienced the second Iraq War and the Afghanistan War, who are otherwise combat exposed and come back with PTSD. We also saw it in Vietnam vets, that combat exposure with PTSD is associated with domestic violence occurring, also with child abuse occurring amongst veterans in this country. And the thing to remember about this is that PTSD in domestic violence relationships seems to be through the hypervigilance group of symptoms, and that these veterans need treatment for both PTSD and domestic violence. Curing one will not cure the other. PTSD does not cause anybody to be violent against their partner. However, it definitely exacerbates it. Casey Taft has developed a really good intervention for domestic violence amongst veterans. It's been rigorously tested. It's called Strength at Home. The effectiveness has been shown for both IPV and PTSD also improves with this intervention. It's not available VA-wide. It's something that would be really good for people to have. So if you're near a if you see a lot of veterans and you're near a VA hospital, you may want to agitate for that. Meanwhile, if you have an abuse survivor whose husband or partner or ex is a military combat exposed veteran and is showing signs of PTSD, remember that they do need treatment for both the PTSD and the domestic violence. So we did a multivariate logistic regression. These are the adjusted odds ratios. The way you think about that is, first of all, if the perpetrator is unemployed, it increases the risk of a domestic violence homicide or near homicide by 4.5 or 4.4 over and above prior domestic violence. So each of these increase the risk over and above prior domestic violence by however much it says. Gun ownership increases risk by 5.5. Perpetrator's stepchild, this is when it's her biological child and not his. So this doesn't mean that blended families can't work. This doesn't mean that every stepfather is going to be hitting his wife. This means that when there is domestic violence already in the home and there's a stepchild in the home, her biological child and not his, it does increase the risk of a homicide occurring by 2.5. What seems to be operating here is that those highly jealous, potentially lethal abusers are also, that child is like a daily reminder that she was with someone else once. When you're looking at odds ratios, if the numbers are on the right side of the decimal point only, it means it's protective. So the couple never living together is protective. It means if she has a place of her own to escape to, this helps protect her from homicide. This means that if you're working with a couple where she's saying, well, you know, as soon as we move in together, this hitting, pushing, and shoving will get better. Or as soon as we get married, things will get better. She needs to keep that place of her own until the domestic violence is dealt with, and that's one of the safety strategies we need to use with women who are thinking about moving in with an abuser. If he's highly controlling, it increases the risk by 2. The combination of highly controlling and she has left him is a very dangerous combination, and that increases, those two together increases the risk by 5.5. If she's left him, even if he's not very controlling, it increases the risk by 3.5. Threats to kill her, these are out loud, overt threats to kill. This is not a symbolic threat. This is out loud, and again, it can be either written, emailed, or text, but this is an overt threat to kill. Increases the risk by 3.2. Threats with a weapon prior, this is a potentially lethal weapon. This is not throwing a cell phone. This is a knife or gun or baseball bat. This increases the risk by almost 4. Forced sex, this is physically forced sex. This is not pressured sex. Pressured sex is a problem for a lot of abused women. However, it is not a risk factor for homicide. So this is physically forced sex, increases the risk by almost 2. And importantly, there at the bottom, prior arrest for domestic violence is protective. Again, I'll say that again. Prior arrest for domestic violence is protective. That's because our systems do something now. When someone is arrested for domestic violence, there's some sort of reaction. So arrest for domestic violence can be and is protective against homicide. Then these are the risk factors for incident level things. These are things that happen at the time of the incident. You see most of the same risk factors are there. Using a gun is highly lethal, increases the risk of somebody dying by 24. The other thing here that's important is the trigger for the actual domestic violence homicide can be when the victim is leaving. And this is one of our safety strategies. If she says to you that she's going to leave him, it's very important that she doesn't do it face-to-face, especially if it's a dangerous abuser. 33% of our cases, she was either sitting down and telling him she was going to leave or in that process of leaving or going back. The other thing that sometimes triggers a homicide is the jealousy when there's a new relationship. Now, this is a new relationship that usually happened after she left him. This was not a relationship that was going on at the time of her leaving, but something that when she got a new partner after she had left him. This is like a signal to him that she's not coming back. The stalking behavior that I mentioned is oftentimes he would explain it as, you know, I'm just trying to get her back. I'm just trying to get her to talk to me. That's why I have to call her 50 times a day, because she won't pick up the phone. And I'm just trying to get her to understand that, you know, we're better off together or whatever. And so oftentimes that when she gets a new relationship, that's a signal to him she's not coming back. That leaving and coming back process oftentimes convinces him that if he just does X, Y, and Z, or if he can just convince her, she will come back. So the other thing that may signal that she's not coming back, she's never going to come back, is if she takes some sort of court action. We had a couple of these homicides that happened. One happened in a courthouse parking lot where they were both coming for a child custody hearing, and of course he knew that she was coming that day, that time, and would be there, and he killed her in that parking lot. He got access to her there. We just had a homicide here in Baltimore where she was coming to the courthouse to do press charges against him for domestic violence, a domestic violence assault. He was out on bail. She was living somewhere where she thought he didn't know where she was. He had apparently followed her there or somehow knew where she was. The day of the hearing, she came out of the house. She put her 2-year-old in the back seat into a car seat. Then as she went around the car to get in her side of the car, he was there with a shotgun and killed her. And again, killed her in front of a child. So again, but this was a signal to him that she was not coming back. If she was going to actually go to court and press charges, these highly dangerous abusers, that's something we need to think about carefully in our safety planning. Our homicide-suicide cases, the same risk factors. There's stalking in 76% of these cases before the homicide-suicide occurred. Gun ownership, an even stronger risk factor. But what was unique to the homicide-suicides were that the abusive partner threatened to kill himself. Many of our proxies said, well, we just thought he was trying to manipulate her. And it was true. He would often say, I will kill myself if you leave me. I will kill myself if you call the police. However, we have to take those threats of suicide seriously. He is trying to get her to do something by making those threats, but people don't threaten to kill themselves lightly. And the tragedy is here that he will take her with him when he kills himself. The men who did the homicide-suicide had somewhat higher education levels than the other murderers. Unemployment was still a risk factor, not quite as strong, but oftentimes the unemployment happened after she left him. He got very despondent. He either was worthless at work and he got fired, or he quit work because he figured, what's the use, she's gone. As I mentioned, these guys were more likely to be white, but there was the same amount of domestic violence prior. They were very unlikely, though, to have ever been arrested for domestic violence. They didn't, quote unquote, look like what many people thought an abusive man would look like. Bottom line here, all domestic violence is dangerous. We should never say that it's not a dangerous case. But the danger assessment can help us differentiate those who are more dangerous from those who are less dangerous. If you don't use the weighted scoring, a rough cutoff is 10 or more yeses. And you'll notice on the danger assessment those with higher weightings are those up at the top. So that helps you on the 10 or more. But it's much more sensitive and specific if the weighted scoring is used. And you remember I showed you this ROC curve before, and that's the article that explains that. So this is the weighted scoring. And you'll notice that the multiplied items are the ones that had those strongest adjusted odds ratios. And note that number 20 does not count. Using that weighted scoring, we come up with levels of danger. You know, less than 8 we say is variable danger. We don't say it's no danger. We don't say it's low danger. We'll never be 100% accurate, so we all say variable because it can change quickly. All she has to do is leave him, and it goes up to another level. Increased danger, 8 to 13, 14 to 17 severe, 18 or more extreme. We picked that language carefully. Extreme danger, many women tell us, is very scary language, and I say good, because it is, it very accurately describes that level of danger on the danger assessment. When you go onto the website, if you click on certification, you can be certified to use the weighted scoring in the danger assessment. The next thing that happens, it will ask you, where were you trained? Say San Diego. When were you trained? Today's date, March the 5th, 2015. Then you'll get one of these forms. You can print out one for every domestic violence case you use the danger assessment with to assess the level of danger. And you see the weighted scoring is right there. Your name will be on there. You can write in the name of the victim, the date that you did the danger assessment. Gives you the weighted scoring right there. You'll put the levels of danger, the increased, severe, or extreme. Your name will be there and the date that you got certified. You can use that the password, which is where were you trained, San Diego, California, when you were trained, today's date. You can use that anytime, so you can go in and get certified today or next year sometime. And it will always give you access to the back part of the danger assessment where you can review the slides, etc., and get more of these certification lists. You can vary your safety planning based on the level of danger. Variable danger, be sure to tell her that the level can change quickly. Watch for other signs of danger and believe her gut. Increased and severe danger, advise her of her risk. And in extreme danger, you want to be very assertive with your safety planning. You want to highly encourage her, if you're in the advocacy side of the Family Justice Center, to get her over to the other side so that there's some criminal justice interventions here and or professional help. So these things are just a couple more data slides showing the accuracy of the danger assessment. There's a few more general principles that you can go over in terms of what you want to think about when you're doing safety planning based on the danger assessment. And the other thing that I want to just mention briefly, there's of course an app for that. At www.joinonelove.org is the danger assessment app itself. You can also get it from your app stores, and also My Plan, which is safety planning based on the level of danger that many young people like to use. And to finish up, one of the things I like to talk about is how we as a system can work together. The Family Justice Center is a place where we can identify offenders. We can do brief risk assessments, things like the ODARA or the DVSIR that are meant to briefly determine risk of reassault. We can use the LAP as a way for first responders to identify those women that are at high risk to be killed, getting that information into the criminal justice system, but importantly, helping women get to the advocacy side of domestic violence, where there they can have a full danger assessment done and safety planning based on it. And that can go to court if she wants it to. And then underneath it are things like fatality reviews, coordinated community responses, court watching, and that information about risk of homicides goes back up through the system on both sides. Finally, I always end with this quote from one of the moms that I interviewed in the femicide study. And I'm sorry I didn't leave much time for questions. If people want to stay on and type in questions, and Casey, I don't know what you want to do about the final slides. I told you it was going to be long.
No, I want to say thank you, Jackie, very much for spending your time to kind of lay the foundation here for getting certified in the danger assessment. It's a great service to the 400-plus folks on this call. Obviously, you need to go to dangerassessment.org and go through that certification process now. There is a small fee for that, but you need to go through that process. It's very foundational to the work that we're going to be doing on our subsequent webinars as we build on the danger assessment around health assessments and health screening, and going deeper into these probe questions that we're developing to ask more about these key elements of the danger assessment, particularly that relate to health. So, Jackie, we do have just a couple of minutes, and I do want to just spend a few minutes on those questions. Quite a number of questions came in, but I'll just pick a couple very quickly. One question was about ownership of a gun versus access to a gun. Have you seen anything in your work that simply having access to a gun is as significant as actually owning a gun?
Yeah, and we asked it both ways. And what we found was that in many cities, Baltimore being one of them, it's very easy to get a gun. There are certain street corners you can go to, and people sell them out of the trunks of their cars. So it's something about that gun ownership, and that for some of these homicides, it's very clear that the gun being there and way too handy, right there in the home, precipitated a domestic violence incident to becoming a homicide. So it is very much gun ownership that is involved here. Now, one of the things you can do on the danger assessment, I always encourage everybody to write all over it, write your extra thoughts to it. If she says, no, he doesn't actually own a gun, but his brother's got one, so he has easy access, I write that down on the side. And then when I'm looking at the levels of danger, I might, if it was right on the borderline between increased and severe, I might bump it up to severe because of that. And you can, again, write that on the danger assessment sheet that you have for each case, so it's clear why you did that.
That's great. There were a number of questions about any studies that have specifically looked at DV homicide numbers going up or going down in relation to a very effective CCR, in relation to a very effective FJC, or geographic proximity. I will just say in response to that, I think it's so difficult to control for all those variables, but I will say that one of the things that we do talk a lot about in San Diego is that there's a big difference between our homicides outside the city limits of San Diego and our homicides in the county of San Diego. Our homicide numbers countywide are quite high. Our homicide numbers in the city were 30 22 years ago, and now we're running about 3 a year in the city of San Diego. But it's very hard to control for any of that.
Right, but I'll tell you, Casey, I'll work with you, and we'll propose something to somebody to do that kind of analysis, because if you did it countrywide, the same way they did with the gun laws, you can see some, perhaps some effectiveness of where there's family justice centers.
Well, and I think, I remember looking at the national homicide numbers and seeing significantly lower numbers in places like Minnesota and some very progressive states around the country compared to some of the Bible Belt states that have huge gun ownership and have these very high rates.
Right. There's that, too.
Yeah. Well, I very much appreciate, Jackie, your time and spending the time with us on this. We are going to wrap up our webinar. The purpose of this, as I mentioned, was this is foundational not only to your ability to be using the danger assessment, get certified in it, and really use it in your practice to make a difference in the lives of victims and their children, but it also is foundational for the purposes of our next two webinars. The next webinar will focus on our Health Services Toolkit that I mentioned that Sarah Wee from our team took the lead on with support from both Blue Shield with our work in 17 family justice centers in California, and that Verizon has helped support on a national level. That toolkit will be placed in the online resource library of the Family Justice Center Alliance on March 16th. Subsequent to that, we will schedule the webinar, and we will look forward to really going deeper into kind of some of the things that Jackie's talked about and how kind of probes and follow-up questions that you should be looking at. We did a lot of looking into these issues that Jackie has researched around reproductive coercion, about the follow-up questions that need to be asked about strangulation assaults and sexual assaults and other indicators in the danger assessment that really are a good lead-in for screening and assessment around health issues with survivors. So that will be the next webinar in the series. This is the toolkit that we're just now finalizing that will be made available to everyone nationally online. We're talking to Jackie about linking it to the danger assessment website as well. It's a very rich in resources. It borrows a lot from Futures Without Violence and the work they're doing around health. Gail Strack and I will be presenting this toolkit in Washington at the National Domestic Violence and Health Conference that Futures is hosting here in a week and a half, that Jackie and many others will be participating in, and we're looking forward to that. And we'll really be looking at, educating you on these key tools that we believe you can use to enhance your practice in working with victims and their children, particularly around the health piece. So I want to thank Jackie for joining us today. Obviously, she's one of the giants in our work, and we're just huge admirers, Jackie, of your work. So thank you. Thank you for being part of this webinar with us today.
My pleasure. And I don't know if you want to ship me the questions, and I'll work through them if you want.
We will. We'll
somehow.
Yeah. If we can answer them, we'll answer them. And if we have some that
sounds like a deal.
you are able to answer, we will follow up with that.
Okay.
So thank you very much for joining us today. Just
My
a reminder,
pleasure.
this webinar has been recorded. It'll be posted on our website within 48 hours. If you go to FamilyJusticeCenter.com, go to resources, then go to our online resource library. It will be posted under the category lethality assessment and high-risk response. We also have a category called Domestic Violence 101, and we have a number of webinars in there done by therapists and advocates that work at the San Diego Family Justice Center that are the application of the danger assessment tool. Dr. Diane Lass has done a recording for us. She did her doctoral thesis on the danger assessment, and that webinar is available to you under the category DV101 if you have an interest in that. And then just finally, we'd love to have you join us in April until our conference sells out. We're encouraging and inviting people to join us. It will sell out shortly, but if you want to come join us, we really encourage multidisciplinary teams to come to our conference and focus on a whole host of issues. This year, our focus will really be on trauma. We've got a lot of national folks really coming in to talk about trauma-informed services and our appropriate responses in dealing with trauma with both adults and children. So on behalf of Gail Strack and Jen Anderson and Natalia Geary, Mike Burke, Michaela, our whole team here at the Family Justice Center Alliance, we want to thank you for joining us today. We want to thank Dr. Jackie Campbell for her presentation, and blessings on all of you in your work. Thanks very much for being with us today.